Assalamualaikum, salam sejahtera IB to one and all. My name is Sina Kamal and I will present my research topic entitled Work-Family Conflicts as a Predictor of Mental Health Among Low-Income Employees in Malaysian Public Sector. I'll be presenting the research background, objectives of the study, conceptual framework, literature review, methodology, findings and discussion for all hypotheses, followed by implications and conclusion. The rise of 0.3 million of B40 group from year 2015 to year 2020 is such an alarming figure that need to raise more concern, as presented by the Government of Malaysia in year 2020 through 11th Malaysia Plan. This low-income group is also not spared from the economic changes, which more job demands need to be fulfilled. According to Corporate Malaysia in year 2017, low-income earners contributed to 16.5% towards gross national income Malaysia and is expected to rise to 20%. The low-income earners' contribution in keeping the economic competitiveness in Malaysia has led to several issues such as inter-role conflict, which they need to fulfill between work demands and family demands. Statistics showed that 15 per working hours in average per week reported by the Malaysian employees, and also 51% of Malaysian employees reported to have at least one dimension of work-related stress. Not only that, in general, 29.2% of Malaysian population was found to suffer from mental health issue. This is reported by the Ministry of Health Malaysia. And in a more specific study conducted by Ashraful Islam, 63.4% individuals from poor economic background suffer from depression. Therefore, these issues have led to a questionable remarks which there is a need for further investigation on the influence of work-to-family conflict and mental health. Thus, a research objective was formulated in this study, which is to examine the effects of work-to-family conflict consisting of three dimensions that are behavior-based conflict, strain-based conflict, and time-based conflict on their mental health issue, consisting of stress, anxiety, and depression among low-income earners who are currently working in Malaysian public sector. Based on the research objective, this is the developed conceptual framework where work-to-family conflict acts as the predictor variable, while the mental health acts as the outcome variable for this study. For the previous literatures related to this study model, work-to-family conflict was found to have a positive influence on mental health across organizations reported by Asian study and non-Asian study. In terms of methodology, this study utilized a quantitative cross-sectional study through survey design. In terms of population and sample study, it was focused on low-income earners who earned a maximum of Ringgit Malaysia 4849 per month. The sample study was selected using convenience sampling technique. This is due to the global health pandemic and the unavailability to obtain the sampling frame of the low-income earners working at public sectors. According to G-power calculation, the minimum sample size required in this study was 166. However, this study was successfully collected a total of 265 data from low-income earners in Johor local authorities. There was a total of 16 Johor local authorities in Johor, but only 8 out of 16 participated in this study because another 8 did not participate due to the confidentiality issues. Work-family conflict scales was used to measure the work-to-family conflict, which consisted of 9 items, which 3 items for each dimensions, while for mental health was measured through depression, anxiety, and stress scale consisting of 21 items. For data analysis, SPSS version 26 was used for data preparation and data screening, consisting of normality test, skewness and kurtosis test, irrelevant and irrelevant items, while for Smart PLS 3.0 was used for inferential analysis and for hypothesis testing. For pilot study, it was found that work-family conflict and mental health have sufficient reliability. Moving on to findings and discussions, behavior-based conflict was found to significantly and positively influence anxiety and depression only, except for stress. This is because based on descriptive analysis, anxiety and depression was found to have none of the respondents to experience normal anxiety and normal depression. But stress, there are a great number of them to experience a normal stress. In terms of time-based conflict, it is very contrast to the behavior-based conflict because time-based conflict was found to insignificantly influence all mental health dimensions: stress, anxiety, and depression. This is due to the fact that the low-income earners working at the public sectors, also called as the government servants, have a fixed working hours which they work from 8 a.m. to 5 p.m. And the respondents of this study was among the administrative staff or the clerical staff, which they have similar work duties. In terms of the relationship between strain-based conflict on mental health dimensions, it was found that strain-based conflict has significant influence on all mental health dimensions. This can be explained through the nature of work during the working from home ordered from the government of Malaysia through the COVID-19 outbreak pandemic, which they need to assimilate with the new norms, which they need to have a fast reply to calls, to emails that eventually lead to arousal of a strain, and thus they experience stress, anxiety, and depression. Moving on to the implications of this study contributed to both theoretical and practical implications. For theoretical implications, this study contributes to the literature through the empirical evidences on the influence of work-to-family conflict on mental health among low-income earners in Malaysia public sectors. For practical implications, the top management and HR or human resource practitioners can provide both behavioral and emotional interventions such as clinical screenings for depression and seminars on breathing mechanisms among employees in order for them to reduce the mental health issues. Not only that, the proper training on communicating the needs among employers and employees can also be conducted in order for them to learn how to prioritize between job demands and family demands. To sum up, the significant findings were found to be on the relationship between behavior-based conflict and stress, while for strain-based conflict, it was found to have significant and positive influence on all mental health dimensions. Based on the effect size of mental health dimensions through the past analyses, depression was found to have the highest effect size affected by all work to family conflict dimensions, demonstrating that the interference at work toward performing family roles led to the experience of greatest depression compared to anxiety and depression. On that account, effective emotional and behavioral interventions should be formulated by the top management, human resource practitioners, and a more specific is the public sector departments or the Jabatan Perkhidmatan Awam in order to foster low-income employees or employers positive emotions. Thank you.